Peters here with Omni Chiropractic, providing solutions to pain and performance. Today I wanted to touch on myofascial pain. What is it and what can I do about it? So if you want to think about myofascial pain, it's pain arising from myo, the muscle, and then fascia, the surrounding tissue. So the easiest way to think about it is with this clementine. We've all had one of these, we've seen one of these. So if you peel it, kind of the outside, the part that we do not eat, was like our skin. And then underneath, once you kind of get and reveal the good stuff inside, which I like clementines because they're fairly easy to peel. The juicy part, like the fruit that we eat, would be like the muscle. And then the surrounding tissue, kind of these little white flakes that kind of give the fruit its structure and allow us to kind of break it apart into these small little ones, that's the fascia. It kind of gives it its structure. It allows for force transmission. So same thing happens in our body. We have the muscles and we have this surrounding fascial tissue. That's important because pain can kind of arise from those structures. So some of the characteristics of myofascial pain is this diffuse wide area of achiness. It doesn't really respond to anti-inflammatory medication very well. There may be some referred pain, meaning I push on one area of the tenderness and it kind of travels up our neck or down into our shoulder blade, not to be confused with radicular pain, which is actually coming from the nerve root and travels along the nerve pathway down the arm. So referred and radicular is not the same thing. So what can we do about it? Like, I like to think about myofascial pain. It's those muscles and those soft tissues crying out for a change. So if you're one of those people that sits at a desk all day and never moves, well, then you obviously need movement. Our sports chiropractic approach helps with that. So on the front end, we kind of put the fire out. We decrease the pain. We have the instrument-assisted soft tissue. We have the myofascial release, the hands-on stuff. We do dry needling, chiropractic adjustments. We want to get some pain relief. And then the second part is we kind of really have to, maybe you're one of those people that doesn't move enough, then we need to talk about posture breaks, getting up and getting moving, setting up your workstation to work a little bit more effectively for you. And then lastly, we kind of have to build that resiliency back up, because if we don't ever build it back up or do some sort of banded exercise or strength training, is that it's going to come back. So we kind of build some movement into that lifestyle. We kind of put the fire out with all of our different tools, and then we build it up with some exercises. So that's kind of our treatment approach. If you have any questions about myofascial pain, what is it, whether you have it or not, I would be happy to answer those. Thank you for tuning in and have a great day.